right, guys, so we are going into chapter 4 here. There we go. Objectives. What is competence and why is it important? Identify 4 skills associated with professional practice. Name the 8 steps. Inquiring skills needed. And what are the 5 procedures that would help you as a student? So this is really respect for yourself in the student years, and we're going to kind of touch base on why these are all important for you. All right, so really as a student, when you're thinking about your niche or kind of what you feel is what you want to do in the field can be kind of hard, and that's hard to figure out as a student. And the reason being is that you have only learned so much in the field. There's so much more that is out there that you can learn. We don't really delve into women's health or myofascial or taping techniques while you're in school, but these are all things that can be your niche. And as a student, it can be kind of hard to figure that out. The desire to help is really one of the best reasons why you're here. Being a people person, I talk about it all day, that you will be talking all day to your patients. Through ultrasounds, through STEM, through exercise, and you're going to really get to know them, and your desire to really want to help them and your love for science and medicine is really going to help you along the way. They talk about a professional role model. A role model is someone whose behavior, example, or success is or can be emulated by others, especially with young people. So when I first graduated, I really clicked on with a therapist named Penny Daly, and she helped me sort of find my niche in myofascial, and she was my role model. She is someone that I wanted to emulate, and I wanted to be like her. I loved how she cared for her patients. I love how much, how detail-oriented she was with not just a patient's injury, but with the entire patient as a whole, and that was someone who I wanted to be like, and that's sort of that professional role model. Also, stop and listen what others are telling you, not just your patient, but each person, either the therapist or aides or PSSs, that can kind of develop some respect. So competence, what is competence? Competence is the ability of an individual to perform a job properly. You will need two things, knowledge and skills. You will need to know the 4 basic skills, which are listed below. You will need technical skills, skill in interpersonal relationships, teaching and administrative skills, research skills with evidence-based practice. You will need to know those 4 basic skills. Technical skills is the ability to safely and effectively apply a given technique to secure a diagnosis, conduct an evaluation, or provide treatment. So you learn about manual muscle testing, you learn about gait analysis, wheelchair safety. Those are technical skills that you are learning to become competent in the field. A skill in interpersonal relationships and communication. Knowing how to effectively communicate with your patient or family and caregivers is vital in how your patients are going to heal. Also, in interpersonal relationships and communication, we also like to put in their constructive criticism. So not only being able to communicate, but take communication from your PT and others. And if you're doing something wrong, understanding that and moving forward and not getting defensive. Teaching and administrative skills. You will teach your patients every single day what they have to do. Exercises, stretches, what modalities to use. But also at some point, you'll want to be a teacher for other students. And that's important. That's what, it's sort of giving back to the field and to the community about what we do. And educating is vital for our practice. Also, research skills with evidence-based practice. And you do this all the time. We're doing it because we're showing that the evidence is actually working. What are we doing that's showing that the patient is improving? Well, I have evidence showing that this is actually effective or non-effective. So this sort of breaks down on how it looks. Things that you've already done because you've already been tested in your competencies. And this sort of phases it from school down to clinical. So you acquire the knowledge related to the skill. You experience the skill applied to yourself. And if you think about modalities, you've done this each time in modalities. You acquired the knowledge. Dr. Patterson lectured for you. You experienced the skill applied to yourself. She showed you how it worked. Apply the skill to a classmate. You've done that to many of your classmates. Observe a professional using the skill. This is sort of where we're starting to phase into that clinical aspect of it. Assist the professional person in using that skill. So you help them do it. Tell them settings. Tell them how to do it. Then that professional will closely supervise in the first attempt to apply the skill alone to a patient. Once it's satisfactory, use the skill in a variety of situations with decreased amount of supervision. So once your CI starts trusting you a little bit more, they're going to relinquish some of that supervision and kind of letting you do it on your own. And then you're tested for basic competency. We do that in the clinic, and you also do that in the classroom. At first, you might need a little bit more time. Again, we don't go over, there's no possible way we can go over every single diagnosis. It's just not possible. So you might need some extra time looking that kind of stuff up. And it's okay to make mistakes. Take ownership on that. No one is perfect. I have made mistakes up until the day I was done. I'm not done treating, but up until my last day. And I'm okay with that because I'm not a perfect person. And you won't be either walking out your first day. So consider the following questions related to your actual attitude. Do you consider yourself a helper? Under what conditions might you resent having to help? Do you expect people to respond to you after you have done your best to help? How do you expect them to respond to you giving your best efforts? What if they're not nice afterward? What qualities make life worth living and who should be better off dead? That's sort of a tough question because there are I've seen some patients where you kind of question that aspect of you couldn't imagine what they're going through. And at what point does someone call it quits? It's sort of interesting. And these are some questions that are tough as a student because you haven't been in the field long enough to really understand how some people would respond to that. So some clinical educations, special challenges when you're on your clinical education. It can be called different things. I've called it all of these. I've called it fieldwork. I have not called it a clinical clerkship, but I have called it rotations. I have called it internships. I have called it affiliations. It could be called many different things. You could also describe it as a situated learning, and that refers to learning that takes place in an actual work setting. There are some challenges with your clinical education. Scheduling. What are the hours? Do those hours work for me? Do I have kids? Do I have family members that I'm taking care of? How is that going to work in with the fact of my clinical education that I'm not getting paid for? Your outside life. What do I like to do? Any notes that you like to take? Different lingo. Each clinic has their own way of describing their own exercises and really being able to jump in there and understand it. And then there's different personalities. Not everyone gets along with each other. As a student, you don't get to pick who your CI is, and there may be some instances that you might clash, and that's just something that you have to learn how to work with, and it can be difficult. Also, transportation. How am I going to get there? How far do I have to drive? What are the directions? That's another one of those tricky things. Suggestions. Always introduce yourself, even to all of the key players. Ask questions, be prepared, and always carry a pen with you because you never know what you're going to have to write down or what's important that you want to keep in your memory for later. Attitudes. 5 ways to reduce anxiety and stress during your clinical affiliation. So, again, introduce yourself to the key players. This is not just your CI. This is not just your PTs. These are your aides, your PSSs, the billing department if they happen to be in there at the same time. All of these people are your team and that you're going to have to work with appropriately. So introducing yourself is important. Try to assess the advanced various protocols. It's sort of impossible to do before you start, but once you get there, understanding what kind of protocols they like to use per patient or per diagnosis, and trying to get ahead of that and memorizing them or getting a copy of them for later. Ask specific questions about the expectations of your supervisor. It's important to understand what does he want from you and what are their goals for them to see you do your work. You want to know what these expectations are of your CI walking into it, because you want to make sure that you're going to meet those expectations. Be aware that your presence may create concerns for employees at that site. I have seen this a lot. There are others that might think that you are walking into their house, and that can be concerning. And not everyone is going to like you being there, and just understanding that and being empathetic to that. Really, everyone wants to help you. There are a rare few that want to see you fail, and that is rare. Almost everyone wants to see you succeed in your learning process, and they all want to help. Preparing for the unexpected. What do you think the unexpected means? It can be a few things. Depending on if a patient falls on you, if you hurt a patient, these are all things that can be unexpected. No one can be really prepared for every situation. It's impossible. We just don't really know what's going to happen. Being able to stay calm when things do happen is important. So making sure, critically thinking that you're being able to survey a situation and think about what's happening as clearly as you can without getting anxious or running away because you're nervous, being able to actually size up that situation. Some people are too ambiguous, having more than one meaning or having more than one possible or interpretation. They jump to their own conclusion sometimes. So if you aren't precise in what you're trying to say, it can cause some confusion. So again, going back to those layman's terms and being specific in what you want your patient to do will help resolve some of those unexpected situations. So remember, no one is always right. When you are a student, we don't expect you to have all of the right answers when you're out in the clinic. We expect you to try. But you won't always be right, and that's okay, but you do always need to put in your best effort. You may not know your own niche day one. You may not know your own niche by the end of both affiliations. That's okay. And remember, no matter how long you worked as an aide or as a tech, you will still be welcomed into a facility as a student. Yes, it is nice that aides and techs or someone with some background knowledge in the field has some experience, but that's experience that's not a PTA. You are still walking in as a PTA student, and so understanding that role is important. You might feel anxious. I know that I always did starting going into my affiliations. 3 questions that most students ask that increase their anxiety is, am I prepared enough to pass this course or clinical? Do I have what it takes? And can I afford to stay in school? Those are the 3 biggest stresses that you're going to find for students in the field. So how do you respond to it? What do you do when you feel those anxious feelings? Identify the source. Is it really the school that's causing the anxiety, or is it coming from something else that's just kind of stemming into your school work that's making it worse? So making sure you're knowing where that source is actually coming from. Share the feelings with your friends or trustworthy classmates by talking to them no longer isolated, and you can find help. And if it persists, then seeking professional help. You need to take care of yourself first and foremost. And if you need further treatment, then you need to get it. There is a huge stigma on mental health, but it is okay to access the assistance that you need. There is a reflection here, which we will actually get back into, so don't worry about this slide for now. So self-respect. And And nurturing yourself. The word nurture comes from root words meaning feeding, taking loving care of, and bringing into full bloom. It can also say help encourage the developmental of. So basically, giving loving care and nurturing yourself is important. We've already talked about values that are different from everyone, but kind of keeping with those values will keep true to yourself and will help keep the self-respect and nurture oneself. You are first and foremost responsible for your own health. When you feel good, you do good. You need to make sure that you are keeping an even balance with everything that's happening. For me, I have myself, my child, my husband, work, I'm going to school, I'm pregnant, and I have to make sure that I'm finding a balance between all of those. And it is not easy, but it's something that I need to make sure that I'm doing for myself. When you're treating your patients, make sure that you are treating yourself. Are you frustrated? Are you anxious? Are you worried? Honing in on those feelings will help you manage them better. And remember, there is a balance between all of those. There will be days where you get sick, where you'll have to catch up or go back. Those are things that you have to realize and make sure that you're understanding your true self. There is a burnout. And actually, the World Health Organization recently added this as a diagnosis. This can happen to students and professionals. I'm sure you guys have all felt it. Usually it happens in week 9 or 10 when you guys are sort of done with classes and over it and you have all these projects to do. No one is immune to it. No one is immune to an illness. No one is immune to someone losing their job and increasing stress. But 2 suggestions that you have to avoid it is adopt a generative approach to your tasks and take time for yourself. Those are 2 suggestions to help avoid burnout. As much as we don't think we have time, I know that we could probably set aside time for ourselves. If you look at your phone right now and kind of look and see how much time you've already spent on your phone today, maybe not including watching videos, but just like watching Facebook or things like that, you could probably see that we all spend a little bit too much time on our phones. And if we take some of that time away to do something for ourselves, it will be better. Also, reaping the rewards. Reward yourself for the good things that you're doing, the grades that you're getting, the hard work that you're putting in, passing your boards. Those are all, something that you need to reward yourself for. Also, one of the best rewards is when a patient remembers your name or when a patient gets better. It's probably the best feeling when your patient comes in the next day going, I really felt better after what you did. And you're just like, oh, thank you. Like I'm effective. You will have weeks where I can remember a few weeks where no one was getting better for me. And you go, what am I doing? I don't know what I'm doing. I don't know how to do my job, but it comes around and it goes in ebbs and flows. And you just have to find what works for you and really take care of yourself. So if we sort of sit here and think and reflect on what we like. So list here the things you most like to do by yourself. So for me, I would probably list sewing. I like photography, and make 2 columns. If you don't already have time for these things, list why. List how you can make a change. Make suggestions to yourself about how you can make more opportunities to do those things that are true to you. This is also a summary of the chapter, which I'm not going to read out loud to you. You can do that on your own. I would still like you to review over the chapter with each PowerPoint that we're doing. And of course, if you have any questions, please don't hesitate to email me or ask me. Okay, guys, thank you. We'll talk to you soon. Bye.